Morphine Sulfate ER Capsule, Extended Release Multiphase 24 hours is a medication that is used to help relieve severe ongoing pain, such as pain due to cancer. It belongs to a class of drugs known as opioid analgesics, and it works in the brain to change how your body feels and responds to pain. It is important to note that the higher strengths of this drug, 90 and 120 milligrams per capsule, should only be used if you have been regularly taking moderate to large amounts of an opioid pain medication. Using these strengths without prior opioid use may cause overdose or even death. It is also important to not use the extended-release form of morphine to relieve mild pain or pain that will go away in a few days. This medication should not be used for occasional, as needed, use. Always consult with a healthcare professional for the correct dosage and timing of this medication. Before starting to take Morphine Sulfate ER Capsule, Extended Release Multiphase 24 hours, it's important to read the medication guide provided by your pharmacist. Take this medication on a regular schedule as directed by your doctor, not as needed for sudden, breakthrough, pain. It can be taken with or without food, once daily. If you experience nausea, taking it with food may help. Swallow the capsules whole, but if you have trouble swallowing, you can carefully open the capsule and sprinkle the contents on a spoonful of soft, cool applesauce. Don't prepare this mixture in advance and don't give it to a child. The dosage is based on your medical condition and response to treatment, and the maximum recommended dose is 1,600 milligrams per 24-hour period. Suddenly stopping this medication may cause withdrawal, so your doctor may lower your dose slowly. Be aware that this medication may sometimes cause addiction, so it's important to take it exactly as prescribed. If your pain does not improve or gets worse, be sure to inform your doctor. Some common side effects of Morphine Sulfate ER Capsule, Extended Release Multiphase 24 hours include nausea, vomiting, constipation, lightheadedness, dizziness, or drowsiness. These side effects may decrease over time. To prevent constipation, it's important to eat dietary fiber, drink enough water, and exercise. You may also need to take a laxative, so ask your pharmacist for the right type for you. To reduce the risk of dizziness and lightheadedness, make sure to get up slowly when rising from a sitting or lying position. It's important to remember that the benefits of this medication outweigh the potential side effects for most people. However, you should contact your doctor if you experience any serious side effects, such as interrupted breathing during sleep, mental/mood changes, severe stomach/abdominal pain, difficulty urinating, or signs of adrenal gland problems. In rare cases, a serious allergic reaction may occur, so seek medical help if you notice symptoms such as rash, swelling, severe dizziness, or trouble breathing. If you experience any other effects not listed here, contact your doctor or pharmacist. And, as always, if you have any concerns about the side effects of this medication, consult with your healthcare provider. Morphine Sulfate ER Capsule, Extended Release Multiphase 24 hours has the potential for abuse and addiction, which can lead to overdose and death. It can also cause severe breathing problems. Your doctor will prescribe the smallest effective dose for the shortest time to minimize these risks. It's important to be aware of the signs of an opioid overdose and have naloxone available, especially if you have a history of substance abuse. It's essential to avoid alcohol and other drugs that cause drowsiness or breathing problems while taking this medication to prevent serious side effects. Do not crush, chew, or dissolve the capsules, and keep the medication in a safe place to prevent theft or misuse. Pregnant women should discuss the risks and benefits with their doctor before using this medication, as it may pose a risk to the unborn baby. If you notice any unusual symptoms in your newborn baby, seek medical attention immediately. Before taking Morphine Sulfate ER Capsule, Extended Release Multiphase 24 hours, make sure to inform your doctor or pharmacist if you are allergic to it, other opioid pain medications, or any other allergies. This medication may contain inactive ingredients that could cause allergic reactions or other issues. It's important to also discuss your medical history with your doctor or pharmacist, especially if you have brain disorders, breathing problems, kidney or liver disease, mental/mood disorders, or a personal or family history of substance use disorder. Inform them about any stomach/intestinal problems, difficulty urinating, pancreas or gallbladder disease. This medication may cause dizziness or drowsiness, and the use of alcohol or marijuana can enhance these effects. It's advised to avoid driving, using machinery, or any activities requiring alertness until it is safe to do so. Also, it's best to avoid alcoholic beverages and discuss marijuana use with your doctor. If you are planning to have surgery, be sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. Older adults may be more sensitive to the side effects of this drug, especially confusion, dizziness, drowsiness, and slow/shallow breathing. For pregnant individuals, this medication should only be used when clearly needed, as it may harm an unborn baby. It's important to discuss the risks and benefits with your doctor. This drug can also pass into breast milk and may have undesirable effects on a nursing infant, so it's important to consult your doctor before breastfeeding. It's important to be aware of potential drug interactions with Morphine Sulfate ER Capsule, extended release multiphase 24 hours, certain pain medications, naltrexone, and products containing alcohol are some examples of products that may interact with this drug. It's crucial to keep a list of all the products you use and share it with your doctor and pharmacist. Also, the risk of serious side effects may be increased if this medication is taken with other products that may also cause drowsiness or breathing problems, such as opioid pain relievers, alcohol, marijuana, or drugs for sleep or anxiety. Be sure to check the labels on all your medicines and ask your pharmacist about using those products safely. This medication may also interfere with certain lab tests, so it's important to inform lab personnel and all your doctors that you use this drug. If someone has taken too much of this medication and is experiencing severe symptoms like fainting or difficulty breathing, administer naloxone if you have it, and then call 911. If the person is conscious and not showing any symptoms, contact a poison control center immediately. In the US, you can call 1-800-222-1222 for your local poison control center, and in Canada, contact a provincial poison control center. Symptoms of an overdose may include slow or shallow breathing, a slow heartbeat, or falling into a coma. So, when it comes to using Morphine Sulfate ER Capsule, extended release multiphase 24 hours, it's important to remember that it's for your specific condition and should not be shared with others. Also, don't use it for a different condition without consulting your doctor first. They may recommend a different medication for that purpose. If you forget to take a dose, just wait until your next scheduled dose. Do not take extra medicine to make up for the missed dose. Make sure to store this medication at room temperature, away from light and moisture. Avoid storing it in the bathroom and always keep it out of reach of children and pets. It's important not to flush this medication down the toilet or pour it into a drain unless you are specifically instructed to do so. When you no longer need the medication or it has expired, make sure to properly discard it. For more information, you can read the medication guide or consult your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.